obviously I was not a fan of the health care plan, and I've been upfront about that, and mainly because I don't think it's addressing the cost issue or the need for us to be responsible for our health care. And so those are the two big, and it's adding to, I think, long-term, financial situation that's bad for the country. That being said, it's a 200-page document. We literally have been trying to wade through, what does this mean for Tennessee? One of the significant pieces of news for us was the Supreme Court saying states can't be forced to expand their coverage of who's covered with Medicaid. So we're trying to figure out what does that mean for us, and it's a little early for us to say that right now.
Is it clear to say that you're worried about spending in the states over this? I mean, it's a huge concern.
Initially, if our estimates are it would cost us $250 to $350 million more a year to cover everyone. We don't really know yet what we're going to do or what that cost would be, but the cost impact to the state is very significant.
Now,
let me go to Chas and I'll come back.
You ended your statement with talking about this in November. Do you really feel like Governor Romney's the right guy? Kerry was considering he put forward a very similar plan in Massachusetts.
Well, I think he is. I think Governor Romney has said he's committed to the repeal of the acts. I've had that conversation with him personally, and I'm convinced that he means that.
Now, you've been a supporter of Romney and you've been against Obamacare. That's not a secret, but your statement kind of came out on the Tennessee website, which is that supposed to be on that kind of format because it's the official state website?
Well, it is. As the governor, people want to know what you think about things, and so when they ask questions, I thought, okay, I didn't send it out on state email to all of our employees or anything, but as the governor, people say, what do you think? Well, that's what I think about it.
Governor, there are some Republicans who are talking about trying to resurrect this health care compact that they had pushed in the legislature last year and this year, which would allow basically the state to take over all federal health care in Tennessee, including Medicare. Do you like that?
Well, I don't know that we have both the means or the ambition to take over all federal health care in the state. I think there'd be some cost concerns around that as well for the state.
What about the healthcare exchange? Is the state prepared to do that without special session?
I think we are. The timetable we're working off of now, we think wouldn't allow us to make, we wouldn't have to make a hard decision on exchanges until January, according to everything the information that TennCare has now. So we're continuing down that path to be prepared for the exchange.
I thought this January 1st you had to show they had a testable system.
I think what we think, and I'll go back and check with Darren Gordon at TennCare. Darren thinks that we can prove that we have a testable system with the funds that we have now before having to commit to putting a full exchange in place.
Is there anything in the opinion that makes you think that maybe the federal government should be taking on more of the burden of putting together these exchanges, or why should Tennessee be putting together?
I continue to think this. We're the ones always saying, hey, we want more state authority over that. We think we should block grant Medicaid to the states. So I feel like if we're saying we want more authority, and this is an area they've said, we'll give you some authority over the exchange and how that works, that we ought to take that. I firmly believe we can run things better than the federal government can.
And the former governor said he thought that the state was going to save money under this ruling. Do you disagree with that?
Who said that?
Bredesen said that yesterday. He said that he thought the ruling would save the state some money. Do you see any savings there?
Well, I don't know. I didn't see what Governor Bredesen said yesterday. And initially, he called this the mother of all unfunded mandates. And so I haven't talked to him since then. I think there's some folks saying, well, the state now doesn't have to take that expanded roles. But, again, what all that means, and we haven't made any decisions along those lines. Anything that would cost the state a lot of money going forward, we're obviously going to try to avoid.